Hello everyone and welcome to your Skeletal Lab List 2, which will discuss the bones of the lower limb. So we're going to start off with our hip bone, which is also known as our os coxa. I've taken this image from a Frank Netter atlas, which just has a bunch of various anatomical images, including all of the images you'll see in this lecture. So before the age of really 18 to 21, our hip bones are actually three separate bones. And this is going to include the ilium, the ischium, and the pubis. So let's talk about each one of those bones individually. We'll start off with the ilium. And I want you to notice that this view here is a lateral view. So think about the outside portions of your hips. So if you kind of put your hands on your hips, it's that side over there. Whereas this view here is our medial view, and this side of the bone is facing inward toward all of your pelvic contents. Okay, so now that we got that situated, let's talk about these structures. So the first thing you have listed there is the iliac crest. And remember I asked you to put your hands on your hips? This is that ridge that you're feeling when you put your hands on your hips. And if we go to the anterior portion of that iliac crest, we're going to see that there is a bump there, and you can see that in green. This bump you can also palpate on yourself. If you put your hands on your hips, toward your fingers where you feel that big bump in the front, that's your anterior superior iliac spine. And this structure is just really describing the location of where this bone marking is. It's the anterior side. There's a superior one because soon we're going to talk about this inferior one. Iliac because it's on the ilium, and spine is referring to the nature of the shape of this bone marking. So it's kind of like a outgrowth of bone here. And below that we're going to find our anterior inferior iliac spine, and I've abbreviated these for you too so you can kind of speak quickly or write them quickly, but for your examination, practical exam 3 that you'll see this on, I want you to actually write everything out. Now if we go to the posterior side of our ilium, you're also going to see a posterior superior iliac spine, and sometimes you can palpate this or see it really well on others. If you've ever noticed on someone's lower back that there's almost two little dimples in their lower back, this is this posterior superior iliac spine, and there's no muscle really sitting in between the skin and this bone, so it kind of pulls that skin in and it creates a dimple. Below that we have the posterior inferior iliac spine that you see outlined in orange. Now if you go below that posterior inferior iliac spine, you're going to see this big notch, this big dip within the bone, and this is called the greater sciatic notch. And yes, it was named so because the sciatic nerve exits through here. So we'll take a look at that and the sciatic nerve in the cadaver lab. Now we're going to switch back to this medial view in order to see this auricular surface for sacrum. Careful not to say articular surface for sacrum. This was named auricular because it's shaped like an auricle, like an ear. So this is a great structure to find on the os coxa, and you'll immediately know that this is my medial view of this bone. Although we say for sacrum because the sacrum actually does articulate here. So there's a little bit of confusion with this. Next thing I have listed for you is the wing or the ala, and that's really this entire, let me see if I have it marked here. It's really this entire portion all in here. So it's this part that spans on out. It's like the wings of our pelvis, okay? And then here you could see, well, where the sacrum is coming together with the ilium. And then our pubic bones are touching one another here. Okay, so on this wing or ala, we're going to have two different surfaces. On our medial surface, it'll be nice and smoothed out. So this is the iliac fossa. The term fossa means a shallow depression. So it's just a shallow depression, just how we saw on our scapula. We had that supraspinous fossa. They were all shallow depressions. Whereas on our lateral view, we're going to see these lines, and I'll kind of outline them for you. Ooh, sorry about that. There we go. We'll see these lines. There's our anterior gluteal line. There's a posterior gluteal line and inferior gluteal line. Don't worry so much about those lines, but look for some lines on the back, on the lateral side here, to know that this is our gluteal surface. It's where our gluteal muscles are going to originate from. And the last thing you have listed here, you're going to see on a medial view of the os coxa, and that's going to be this roughened area. Oh, my animations aren't working well. This roughened area here, right superior to this auricular surface for sacrum, and that's going to be the iliac tuberosity. If you remember back from our first lab list screencast, anytime you see that word tuberosity, it means a roughened or perforated bump. Okay, so now let's jump into our second bone of the os coxa, and that is the ischium. Our ischium has a tuberosity as well. So if you take your hands and put them on your rear and sit back down, you're going to feel two bumps that you're sitting on within each cheek, let's say. So this is your ischial tuberosity, also known as your sit bone. If you're into yoga, they always talk about your sit bone or sits bone. It's this one here. It's your ischial tuberosity. Also, this is where your hamstrings are going to originate from. Next, we have your ischial spine. It just is lower than your greater sciatic notch that we identified earlier, and it sticks out like a thorn. Okay, your ischial spine or spine of the ischium. And so below that area, we have another dip. Oh, I only identified it on the lower one, but I'll point it out with my arrow here. Right here is your lesser sciatic notch, and we're going to have some other nerves coursing through here that we'll talk about in your nervous system. So I always like to kind of go through in a line back here to describe structures. Here's your PSIS, PIIS, greater sciatic notch, ischial spine, lesser sciatic notch, and then you have your ischial tuberosity. So you can kind of memorize them in a row like that if that helps. Okay, next part, it can also be a little bit challenging for students. So whenever you see this word ramus, it means branch. And we have two portions of our bones coming together here. We have the ischium coming together with the pubic bone, excuse me. And so when they come together, this area, this entire thing, is known as the ischiopubic ramus, this entire thing. If I have a mark here, more on the ischial side, you would identify this as being the ischial ramus, because this is the ischial part of the branch of the ischiopubic ramus. So there's your ischial ramus. Okay, and then we'll talk about the other parts when we discuss your pubic bone. So this arrow represents the ischiopubic ramus because we're including both the ischial bone and the pubic bone. Okay, so let's move into the pubis. Now, if we look at this medial view, we are going to see the symphyseal surface. And this is that portion that is going to come together with the other os coxa. So I'm going to go back real quick to this image. So right in here would be where your symphyseal surface is, and it comes together with the symphyseal surface of the other os coxa and creates the interpubic joint. And remember, this joint will only move during childbirth. So sorry guys, your interpubic joint hopefully will not move unless it's due to injury. Okay, so let's go back to that. Here we go. That symphyseal surface. Now, if you look above that area, you're going to find that Oh, I forgot to put an image in here. So here's your pubic symphysis, and you can see we have a ton of ligaments holding that in place as well. Okay, moving on to our next term will be the pubic tubercle. So if you look at the symphyseal surface and look right above it, there's a sharp bump here, and that is called your pubic tubercle. You can see that on the lateral view as well. All right, now for more rami. So this pink portion here is known as your superior pubic ramus, and below that we have a inferior pubic ramus. So this would also be the inferior pubic ramus. Now our superior pubic ramus does not have any part in the ischiopubic ramus. This is a completely different part. However, this inferior pubic ramus is a part of the ischiopubic ramus, this entire branch. So I could say inferior pubic ramus plus ischial ramus equals ischiopubic ramus. Oh, and I have that slide for you right here. There's our ischiopubic ramus. There's my ischial ramus, and there's my inferior pubic ramus. Cool. Okay, now we have a structure that's created by all three bones, the ilium, ischium, and pubis all together, and that is the acetabulum. Acetabulum was actually named so after acetic acid because they used to use a ladle to scoop out vinegar from the barrel. And so anatomists thought, oh, this looks like a ladle shape, which it's very deep, like a deep pocket for the head of the femur. And so they named it acetabulum. So we find this on the lateral surface only. It is made up of those three bones, and they fuse together between the ages of 18 to 21. And like I said, the head of the femur is going to articulate here. Now there are two different parts to the acetabulum. Okay, there's our view of the head of the femur articulating with the acetabulum. Okay, so there are two parts here. This opening portion here is known as the notch or the acetabular notch. And then the moon-like surface is going to be known as the lunate surface. And we have a hole here, so we're going to use the term foramen. So foramen means hole, but obturator means to stop up. And that's because we have a membrane. That's the hole there, but the membrane kind of goes across like this. This obturator membrane stops up or closes up this hole. So the obturator foramen is created by two bones. You can see it's kind of encirculated by the pubis and the ischium. So before we move on, I just want to make it clear that from the hip over to the knee, we're going to call that the thigh. And from the knee over to the ankle, we're going to call that the leg. So we wouldn't call this entire thing the leg. We would call this entire thing the lower extremity. This would be the thigh, the leg, ankle joint, and foot. So let's continue on with our femur. This is the longest bone in the body. Femur means thigh in Latin. And we're going to see the head of the femur is a nice spherical structure that will articulate with the acetabulum that we just saw on the os coxa. Now, if you look at the head of the femur, you might see this little dip here, and that is called the fovea. And the fovea is a little depression that you can kind of fit your pinky into that will have a ligament to attach to the acetabulum, holding the head of the femur in place a little bit more. Below the head, we're going to have a constricted area that's known as the neck of the femur. And then just how on our humerus we had those two bumps, these bumps are a little bit more irregular, and so anatomists gave it a new term and called it trochanter. So we have a greater trochanter that's going to be larger of the two bumps, and a lesser trochanter. And here's another view. This is a posterior view of our femur now, whereas the view we saw earlier is an anterior view. Your lesser trochanter is right here. Okay, so this is better seen on a posterior view. Now, sitting in between these two trochanters is the intertrochanteric crest. We can only see this posteriorly, whereas our intertrochanteric line, we can only see this anteriorly. So it's, again, connecting this greater trochanter down to the lesser trochanter. So the best way that I've found to learn this is going to be PC, like Mac or PC person. I'm more of a Mac person, but anyway, PC, we use that to remember posterior is the crest. And then for intertrochanteric line, one of my favorite cities is LA. The line is anterior. So that might help drill in that the line's anterior and the crest is posterior. Now, underneath our greater trochanter, this is going to be another depression that you can fit your pinky into, is going to be the trochanteric fossa. Trochanteric fossa. And we have another roughened bump on this bone. This will be our gluteal tuberosity. And we're going to have our gluteus maximus muscle inserting here. So this is really cool because you can see a neat dissection of this in the cadaver lab, and that muscle moving straight into that roughened bump, gluteal tuberosity. Looking at the rest of the femur here, we're going to have the shaft or the body, easy enough. This is also known as the diaphysis, which we'll discuss in chapter 6. And on the posterior view here, we're going to see this really thick, rough line called the linea aspera. And that's in fact what it means. Linea means line, aspera means rough. So it's a rough, thick line. Now we're going to move to the distal portion of the femur. We will have these bumps on our condyles known as the medial and lateral epicondyle. And again, our medial one is going to be a little bit bigger because there's another extra structure on there, which I'll discuss in a moment. And to separate out the condyles, I want you to look in this region here outlined in purple. This is your medial condyle of the femur, and this is your lateral condyle of the femur. So I want to take a moment now to mention on your exam, if you have this marked, you can't just say, let's say, medial condyle, because there's a medial condyle on a couple of bones. We have it on the femur, we have it on the humerus, there's one on the tibia. So you want to be specific. You need to say medial condyle of the femur. Now in between these condyles, we have a depression, and this is going to be your intercondylar fossa. Inter meaning between, condylar referring to the condyles, and fossa meaning shallow depression. So it's a shallow depression between your two condyles here. Okay, so I mentioned that that medial epicondyle is a little bit larger than the lateral epicondyle. And the reason for this is because we have another extra bump sitting on top here, and that is the adductor tubercle. It's called adductor tubercle because we'll have some adductor muscles inserting onto this bone marking. The other thing we're going to see is the patellar surface. So you can imagine that you only see your patellar surface on the anterior view because that's where our patella is going to be. So that's right over here. And then our popliteal surface you can only find on the posterior view. Okay. All right, so now we're going to discuss our knee joint and some associated structures. So we'll start off with the patella, and our patella is a sesamoid bone, meaning it's encased in tendon. It doesn't really truly articulate with any other bone here. It's kind of sitting on top. And we have a patellar ligament that will attach from the patella over to what we'll soon know to be the tibial tuberosity, which you can feel on yourself. If you feel your patella and then shift on down, and you'll feel another bump right before you get like a dip into the shaft of the tibia, that's going to be your patellar ligament. Okay, so here's our patella. And how do you tell a right patella from a left patella? Well, what you're going to do is if you have one in lab, you look for the apex, which is going to be the pointed portion of the patella. You point that away from you, and this patella isn't completely flat on the back side that you don't see here. It's going to tip down toward the side that is either right or left. This is a little difficult to describe when you can't see this tipping happening. So we'll do some examples in lab. But if your apex is away from you and the patella is falling toward the left, then this is going to be a left patella. Now, in this view, we've removed the patella out of the way, and we can see the femur up here and the tibia below. And we're going to see a ton of ligaments around here. So I'm going to describe these ligaments to you. First, we have your medial and lateral menisci. Menisci is plural, meniscus is singular. So this is really made up of fibrocartilage, and it helps to cushion any shock that we're going to get between our femur and tibia. So if I remove the femur out of the way, you could see this crescent moon shape that these menisci have sitting on top of the tibia. Now let's move into our cruciate ligaments. Cruciate means cross, so you can see how these ligaments are kind of crossing each other over here. So in red, I have my posterior cruciate ligament, which is the PCL, and this is attaching the medial condyle of the femur over toward the posterior surface of the tibia, which is why we call it the posterior cruciate ligament. And our anterior cruciate ligament is attaching from the lateral condyle of the femur over to the anterior side of the tibia, which is why it's called the anterior cruciate ligament. So if this ligament was not here, the ACL, we would be able to pull that tibia anteriorly. And next we have our collateral ligaments. So this is kind of on the collateral sides of our bones here. So first we're going to see the tibial or medial collateral ligament. Okay, we could see that connecting that medial side of the medial condyle of the femur to the medial surface of the tibia. And then we have our fibular collateral ligament, or we can also call this the lateral collateral ligament or peroneal collateral ligament here on the lateral side. The reason we have this extra term here, peroneal, is because fibular and peroneal are used interchangeably now. Those doctors or health professionals that have kind of gotten their schooling back in the day probably call it more peroneal because that's how they were taught, whereas the newer generations, they're using the term fibular. So it's important to know both as this term is in transition. Okay, so now let's talk about the two bones we find in the leg, and that is the tibia and fibula. Our tibia we're going to find more on the medial side, fibula more on the lateral side, and they are held together by an interosseous membrane. So let's break that word down. Inter meaning between, osseous meaning bone, and membrane, of course, is just some connective tissue. So sitting in between the tibia and the fibula. And we also have this in the forearm too, between the ulna and the radius. So let's start with the tibia first. Our tibia, like I mentioned earlier, also has condyles. We have a lateral condyle and medial condyle. This one being our medial condyle because we know our fibula sits laterally, so that would make this the lateral condyle. And then if we go a little bit inferior to that area, we're going to see our tibial tuberosity. Now remember, this is where your patellar ligament attaches to, and it's also where all of your quadriceps muscle on the anterior surface of your thigh are going to go and insert into. We have our body or shaft, which is easy enough to remember. That interosseous border on our tibia will face laterally because we know that interosseous membrane will sit in between here to attach to that border. Now I'm looking at a posterior view of our tibia. You're going to see some lines back here on the shaft, and that's known as the soleal line. We call this the soleal line because there's a muscle named the soleus that originates from this area. If we look at the distal portion, we'll see that there's an inferior articular surface. This will articulate with the talus, which is a part of the tarsals in our foot. So it'll help create the ankle joint. On our tibia, we're also going to see a structure known as the medial malleolus. Now, one of my pet peeves is people will talk about the ankle bone. The ankle bone, oh, I hurt my ankle bone. Well, there really isn't an ankle bone. It's actually the ankle joint. And what most people know as the ankle bone is really just a part of the tibia and the fibula. So I want you to put your hands right around your ankle. And on that medial side, where you feel that bump on the medial side of your ankle joint, you will feel the medial malleolus. And if you feel the other side, the lateral side of your ankle joint, you're feeling the lateral malleolus of the fibula. And notice how this one sits a little bit lower than your medial malleolus. Okay. The last thing we need to mention on the tibia is your fibular notch of the tibia, which you'll find right in this region. So it's just a little dip where the fibula will articulate with the tibia. So next we have the fibula, and the hardest thing about the fibula I find students concerned with is being able to tell the lateral malleolus apart from the apex. So our apex is that pointed projection at the top. And below that we will have the head, and then the more constricted portion will be the neck of the fibula. We also have the interosseous border, which our interosseous membrane will attach to. And then we've already discussed our lateral malleolus. Now our lateral malleolus also has this articular facet to it. So I've put in a posterior view here for you to see it. It's just a little dip. Once again, you could put your pinky right in it, and that's how you're going to tell the difference between your lateral malleolus and your apex. This is more pointed, and it does not have this articular facet to it that our lateral malleolus will. Okay, that brings us to our tarsals. So first we have our talus, which I always like to say is the tallest, because if you look at a lateral view of the foot, you will see that this one sticks up the most. The calcaneus, most of you already know, is your heel bone. Cuboid is shaped like a cube. We have navicular that is shaped like a navy boat. And then we have our cuneiforms right below here. Your cuneiforms were named based on location. So you have your medial cuneiform, also known as your first, because it's lined up with your first metatarsal or first digit. Then we have your intermediate cuneiform or second cuneiform, and lastly your third cuneiform or lateral cuneiform. And the word cuneiform means wedge. So you'll see in the anatomy lab that this superior surface or dorsal surface, dorsum of the foot, is going to be wider than the plantar surface of your foot. So it's kind of like a door wedge here. And of course our metatarsals and phalanges are going to be very similar to the hand. So all of these metatarsals are going to have a base, body, and head. So let's do an example of trying to identify one of these. So identify the structure at the red dot. So is this base, body, or head? You're going to start small and build big. So this would be the head. Oh, I put the whole answer there. Let's go one by one. So here's the head. It says of the blank, so this is the first metatarsal, blank, blank, of the, this would be our right foot. So there's our answer. And our phalanges, like I said, will be the same as the hand. So each of these proximal, middle, and distal phalanges will have a base, body, and head. Keep in mind that that first digit will not have a middle phalange. So it just has that proximal and distal phalange. So let's practice identifying here as well. We have base, body, or head here. So take a minute to answer that. It would be base, body, head. So here's our base of the blank phalange. So let's say proximal, middle, distal. So this would be our proximal phalange of the second digit of our right foot. Okay, and this is that lateral view I was describing. You could see that talus is the, sorry about that, talus is the tallest. The calcaneus bone makes up the heel. This would be your cuboid bone. Here's navicular, and this would be, we can only see two of your cuneiform bones here. This would be your third or lateral cuneiform and the intermediate or second cuneiform. Your metatarsal bones, and of course all of your phalanges. So that is going to be the end of this screencast. If you have any questions before our lab on Thursday, please let me know. Otherwise, have a wonderful day.